Now, it's poorly understood as to why one part of the muscle getting the same stimulation as the whole of the uterus just starts to grow. It just happens that way. They're not too sure, it's not understood why. It's very common in black people, and you don't tend to get Caucasian and white people don't tend to have the size fibroids we talk about in the Caribbean, because we do get some large fibroids, and that is why we tend to have to treat it, right? So once it starts to give problems and complications, and you start to worry about it, then the doctor will worry about it and will advise you to take it out. But as I said before, fibroids, because it's not cancerous and it's a benign growth, it should not cause death per se.
But you're saying that person should not worry about it if it's, but if it's there, do you advise that, you get rid of it?
No, I don't normally would not tell my patients to get rid of it unless it's a bother or problem to you, because it may be found incidental. When I say incidental finding, it means you come to the doctor, the healthcare provider, for your regular checkup, and on examination, they may find that the womb, which normally is around 5 to 6 centimeters in size, you examine it and it feels, it's not as smooth as it should be, it feels irregular, it feels nodular, and we may say, oh, you do have some fibroids here. But we know it's not a cancer, it's a benign growth. So we'll advise you. Now, unfortunately, once we advise patients that they have fibroids, they think they must do something about it and they must take it out. And it's surgical, the treatment is surgical. So you'd have to get major surgery to take it out. You can take out the womb, or we can just take out the fibroids per se. But it's a operative procedure. So therefore, I usually suggest to the patients, if it's not bothering you, you don't have any problems with baby, you're not having any pain, because some patients do get a lot of pain, and they do get heavy bleeding, so heavy that they need transfusion. Now those patients would need to take out their fibroids, yes. Mm-hmm.
Now, when do they grow and at what rate?
Okay, normally, as I mentioned earlier, you wouldn't expect young patients like 18-year-old, they just start to have a menstrual cycle. The effect of estrogen would have just started. So we wouldn't expect you to have any size fibroid to be worried about. What if you do have any seedling, it would be like a gungo peas. You call it gungo peas, you call it pigeon peas in St. Vincent. It would be like a pigeon peas. Okay, so we wouldn't worry about that. Now, as soon as you become reproductive age, and you start to, get pregnant, making babies and stuff, the estrogen is, so much more increased when you're pregnant, that it starts to stimulate that little area that is sensitive to the effect of the hormone, and it grows rapidly. It grows rapidly out of growth of the next surrounding muscle, the surrounding muscle that is there, so that it grows out of proportion. And I brought some samples here for you to see how it happens, is that this, as I mentioned earlier, the uterus is quite small, but when you get fibroids, it can become big. And this is actually just from one patient, and it's just one uterus with all these nodules are area of fibroids. All these nodules you see here are areas of fibroids, and as you can see, they're different locations. This is actually just the muscle wall of the uterus with 1, 2, 3, 4, 5, 6 fibroids, but they grow differently. This big one here has stayed within the muscle, but this one here has grown out, so it's sticking out from the uterus. So when we do examination, we can feel that the womb is enlarged, we can feel that it is irregular, or we can feel that it's smooth. If it's smoothly enlarged, then we know the fibroid is within the muscle. If you get irregularities like these bumps on the outside, then we know it's growing outward. Now, if you have the fibroid within the muscle, when you get pregnant, that could cause you to lose your pregnancy, because it's within the muscle. It may compromise the space for the baby. It may also compromise the blood that's supposed to go into the baby, because the fibroid is excessive tissue within the ball, so it needs more blood to feed it. And what may happen as well in the pregnancy is that because the blood is being channeled, it's growing rapidly, enough blood is not coming in, the tissues within it start to die, and you can get severe pain because of the death and necrosis, what we call medical term necrosis in the middle. Now, if it's on the outside and you get pregnant, we don't worry. That this on the outside should not compromise the baby and the cavity. If you notice, this is actually the cavity here, It's mushed pushed away by the fibroid. So if you can imagine if this person had gotten pregnant, what would have happened? The baby wouldn't be able to get space to grow, even though the uterus is expanding. The fibroid would also be expanding with the uterus. So it can actually compromise the baby growing within the cavity. And with all these fibroids, the blood would also be going to the fibroid too, so that it will compromise blood going to the baby. Now that doesn't mean that it will happen to every woman, because I'm talking about this particular patient with this amount of fibroids, because you may get isolated fibroids, and these are isolated fibroids. So instead of a hysterectomy, where we take out all, because if we were to try to just take out these fibroids, the woman would be left with not much of a uterus, not much of a muscle, because most of her muscle is taken up with fibroids. So a myomectomy for this patient would be preferably not. Now for this patient had these fibroids. You can see it's quite different to all of the amount you see here. And they're different sizes. So if you, for example, had brought me an ultrasound report that said you have a fibroid of 2 centimeters, that's it. It shouldn't be a bother to you. Okay? But if you brought me an ultrasound that says multiple varying size fibroids, and I know the womb is normally about 5 to 6 centimeters, and it says one measuring 8, one measuring 5, one measuring 4, that's a lot of space, muscle space that is being taken up by fibroids alone.
And
so when you, and that is, yes, one person, yes, this is one person with all these fibroids, this is another person, this is one person. And this person had what we call a myomectomy. So we went ahead, she was young, she desired to have children, possibly might have been having problems to get pregnant anyway, because fibroids can block the tubes, they can block the space where the baby should grow. So there are times when it's necessary to do a myomectomy. So this is a myomectomy specimen where we just took out the fibroids. Again, it's not cancer, you don't need to be worried. The only reason why they were removed because the patient was having some discomfort, or maybe the patient wanted to make baby and was concerned about trying to make a baby with competition that the baby would get with all these fibroids. But we do have women who have gone through successful pregnancies with multiple fibroids. They do have problems. Some of the patients, we have to put them off from work because they get so much pain because of the excessive growth of the fibroids with the pregnancy. They get a lot of pain. And then they may get bleeding as if they want to lose the pregnancy. So again, we may have to put them off and let them rest throughout the pregnancy instead of working. It's not that the rest make the pain less, it's just that it relaxes the patient more.